Disease of mitochondrial inheritance. Continuing with part 2. So here we look at M for MELAS. So this is an abbreviation. So it includes the mitochondrial myopathy. Mitochondrial myopathy. Next E for the encephalopathy. Then L. L is for the lactic acidosis. Then S for the stroke-like episodes. Then we look at MERRF, that is MRF. So in case of MERRF, so this includes the myoclonic epilepsy as well as the ragged red fibers in muscle. Next there is also the ataxia and the sensory neural deafness. Next we look at the NARP, N for NARP, N for the NARP. So this is nothing but the two clinical patients. That is, there can be neuropathy as well as the ataxia and the retinitis pigmentosa and dementia. Then what we see is there is a severe infantile encephalopathy, and this is the lesions of the basal ganglia. So then comes the O. So this O, if you see, it stands for, the O stands for the chronic progressive external ophthalmoplegia, and this is nothing but the CPEO. And what this stands for is the ophthalmoplegia, cardiomyopathy. Next comes the ptosis, heart block, then ataxia, the retinal pigmentation as well as the diabetes. Then we look at P for the Pearson syndrome. So the Pearson syndrome, it includes the pancreatic insufficiency, pancytopenia as well as the lactic acidosis. So just to recap, we started with the MELAS. So what is this MELAS? It is nothing but the mitochondrial myopathy, encephalopathy, lactic acidosis, stroke-like episodes, as well as MRF, which stands for the myoclonic epilepsy, and the ragged red fibers in the muscle, ataxia, sensory neural deafness. Next we saw the NARP. So NARP is nothing but it is two clinical patients, that is includes neuropathy, ataxia, retinitis pigmentosa and dementia, and next it also includes a severe infantile encephalopathy with the lesions in the basal ganglia. Then we look at O. O stands for the chronic progressive external ophthalmoplegia. This includes the ophthalmoplegia, cardiomyopathy, ptosis, heart block, ataxia, retinal pigmentation and the diabetes. Then what we look at is the P. P is nothing but the Pearson syndrome. This includes the pancreatic insufficiency, pancytopenia and the lactic acidosis.